Burden.
Hello, I'm Rachel Burden. The coronavirus outbreak began in China, but here in the UK, we're beginning to feel its impact. Health fears, concerns about jobs, dramatic changes to the way we live. Over the next 30 minutes, we'll do our best to make sense of it all.
There's so much information flying around. Social distancing, self-isolation, what does it all mean? I'm Fergus Walsh, the BBC's medical correspondent. I'll be explaining the efforts being made to tackle the crisis.
The UK is grinding to a halt in a way that very few of us have ever seen before. It's because of the series of dramatic measures announced by the government to try to stop the spread of coronavirus. For all of us, that means avoiding all non-essential travel, both at home and abroad, reducing our social contact, so working from home, and no trips to pubs or restaurants. And of course, that major development that schools across the UK will close on Friday. What about those vulnerable groups then? The over 70s, pregnant women and people with underlying health conditions should all take special care to avoid unnecessary social contact. Around 1.4 million people in the highest risk category should avoid friends and family for 12 weeks. If you have symptoms, a persistent cough or fever, and you live alone, then you should stay at home for 7 days. If you live with others, you should stay at home for 14 days. And if you're still not better, you need to use NHS 111 online or by phone if you have to. Of course, that's the official advice, but it leaves all kinds of questions, and we'll try our best to answer as many of them as possible. We're live on BBC One and BBC 5 Live, and you can get in touch using the hashtag BBC Your Questions. But first, let's have a look at the story of coronavirus in the UK so far.
We must act like any wartime government.
No bread, no eggs, no toilet paper.
It's scary. They've got mortgages, they've got kids to think about, rent.
In just a few short weeks, everything we've taken for granted has changed. Travel, work, everything. It started slowly. 2 members of the same family from China staying at this hotel in York, the first confirmed cases. The virus arrived from places like China, Hong Kong, Singapore, and then Italy.
Happy birthday to you.
The early advice from government to wash our hands. For a month, numbers stayed small. The government laid out its strategy.
Contain, delay, research, mitigate.
The first death from coronavirus in the UK as the number of cases doubles in just 48 hours.
The 5th of March, exactly 2 weeks ago, and the first death. A woman in her 70s with underlying health conditions. Now things move quickly.
COVID-19 can be characterized as a pandemic.
As a global pandemic is declared, Italy is already in total lockdown. Then this from the Prime Minister.
More families, many more families, are going to lose loved ones before their time.
Should schools be shut?
Pressure grows. The government says its strategy is to use the right measure at the right time. Then, on Monday,
Now is the time for everyone to stop non-essential contact with others.
it is the biggest restriction to normal life in peacetime. But still there are questions. Is the NHS ready? Is there enough testing? What happens when schools close? Will workers be properly supported? The next few months will be a remarkable challenge for all of us. Well, tonight we want to answer as many of your questions as we can. Please send in your comments using the hashtag BBC Your Questions. First, let's talk to our medical correspondent, Fergus Walsh. And Fergus, let's start with that news, huge news about the closure of schools right across the United Kingdom. Karen is just one of many parents who's got in touch to say, how am I going to manage with childcare? So why have they taken the decision to do this now?
Well, this has been inevitable since Monday, when everything changed, when we had a very sobering report from scientists at Imperial College London that said unless the UK threw everything at this and tried absolutely to suppress coronavirus, we could have a huge number of deaths here, as many as 250,000. Now, 30,000 beds are being set aside for coronavirus patients because of what we've seen in Italy. In Italy today alone, they've registered 475 deaths in one day, 2,000 in the past week. Now, most of us will get a mild illness, but it gives you an indication of what this virus can do.
Yeah, and those are frightening figures. Do we have any idea how long these school closures are going to last for?
Well, a long time, I would think, because the scientists who've been modelling the epidemic have said that as soon as you lift restrictions, the virus will flare up again. Now, obviously, children have got to get back to school, but we're talking about months. It's going to be maybe 18 months before we get a vaccine. We might see the restrictions eased a bit and then reimposed. But there is no exit strategy for the UK for any other country in the world. It's going to have a massive economic and societal impact, and there are no good options here, only bad ones.
Well, we're going to hear from the Chief Medical Advisor very shortly on all of that, actually. But of course, this strategy, Fergus, is about protecting the most vulnerable, isn't it? And loads of people in touch about that. This is a question from Janet. She says her husband is in his mid-70s, fit and healthy, still working full-time. They rely on his salary. Should he still be going to work? OK, so the over 70s fall in the group where the really, really strong advice is work from home, don't use public transport, and your employer really should take note of that. So he should work from home where possible. What about the underlying health conditions we frequently hear being referred to? Caris is 43, she's been in touch, she's got mild asthma, so she does get the yearly flu jab. She's asking, does she need to self-isolate? Would her husband need to as well? No, as long as they're well, they don't need to self-isolate, but they should really take the advice on social distancing. There is one group of 1.4 million people who are being advised to shield themselves for 12 weeks. And they are people at particular medical risk, and they will get advice, and it's people who've had an organ transplant, cancer patients undergoing chemotherapy or radiotherapy, people with blood cancers, and people with particularly severe respiratory diseases like cystic fibrosis. And they do need to shield themselves for nearly 3 months. What about for pregnant women? Because the advice on that has changed slightly. Chloe has been in touch. She says she works in the NHS. She's a nurse. She's pregnant. Should she be staying at home? Well, the advice there, again, strongly is to work from home. We don't know of any particular risk to pregnant women. It's purely precautionary. Fergus, for the time being, thank you very much. As well as advice on schools today, we've also had a first look at the government's new advertising campaign, which will be broadcast on TV from tomorrow. Let's take a look.
This is a message from the government's Chief Medical Officer about coronavirus.
It's important we all protect older people and those with existing health conditions from coronavirus. If you or anyone in your household has a high temperature or a new and continuous cough, even if those symptoms are mild, you should all stay at home. Don't go to the GP or hospital. Instead, go to nhs.uk to check your symptoms and follow the specialist medical advice. Only call NHS 111 if you can't get online or your symptoms worsen.
Protect yourself, protect others, protect the NHS.
Well, that was Professor Chris Whitty, the UK's Chief Medical Advisor, fronting the new public health campaign. And I spoke to him in the last half hour and began by asking him about the new advice about school closures.
So we very much appreciate that actually closing schools is extraordinarily inconvenient for families and very disruptive for children. So we were very keen not to do this before we had to. But we've now reached a stage in the coronavirus epidemic where closing schools is going to help slow the rise of the epidemic and help the NHS to cope. And that's the reason we're doing it. It's not because schools are dangerous for children, they're not, but it's because it's going to slow down the rise of the epidemic.
One of the reasons we know that you were holding back on doing this was because you were concerned it would take out parents potentially who work in the health service. So how are you going to get round that?
You're absolutely right that this is something which is difficult for parents, not just who work in the health service, but the key thing that we're having to do at the moment, as we have the coronavirus rising, is to protect the NHS, and that means having the maximum number of staff there. So we were very keen that in addition to closing the schools, we also made it possible for NHS staff to have their children go to schools to be looked after if that's what's needed for them to be able to go to work.
So that will be an option, presumably, for people who work in the NHS, but not necessarily a necessity?
This is something which is going to be more details will be coming from the Department for Education in due course. But what we're trying to do is make sure that this is not disruptive to the NHS any more than we can avoid.
And can you give us an idea, we heard key workers being referenced earlier, what that actually includes?
At this stage, the key people, obviously, I'm the Chief Medical Officer, so for me, the people who I'm really thinking about is people who work in the NHS, not just doctors and nurses, but more widely to help the NHS to continue to work. There will, of course, be other people in the rest of the public sector we'll be thinking about, but the NHS is the group that we're particularly keen to protect at this time, as the coronavirus is going to lead to an increase in the activity of the NHS over the next few weeks.
So many questions from parents, from carers about this. Let me just read you one from Jo, who's been in touch. She says she's got 2 children. She's asking if she can take them to the park and other places when schools are shut, or do they have to be completely housebound?
So it's very important that children and adults take exercise and enjoy themselves as much as they can. Being outside in the park is a very good thing to do, and taking exercise is always a good thing to do. The thing which we're trying to avoid is people meeting up unnecessarily or having unnecessary social contact. So going to the park, yes. Crowding together with lots of friends for long periods of times, that's the kind of thing we would rather people did not do.
But you could potentially have a kickabout with a ball in a park with your friends?
Yes, again, the key thing is to avoid the close social contact. But if it's in the open air and people are keeping their distance, then we would certainly want people to continue to enjoy themselves.
We know that this is also very much about protecting vulnerable groups. We've talked about the impact on the over 70s and what you're asking them to do in terms of social distancing. So let me ask you this from Karen. She says, what happens to kids whose parents still need to work if grandparents are at risk and can't look after them?
So this is one of the things, and we fully appreciate that every family is going to have unique circumstances that will be quite difficult. Obviously, some grandparents are actually relatively young and healthy, so it's not the fact they're grandparents, but you're absolutely right. We want everybody to reduce their social contact quite significantly to help protect the NHS. And people who are most likely to come to trouble if they get coronavirus, so that's older people over 70 and people with pre-existing health conditions. We're very keen they take even greater precautions not to mix with other people, because if they catch coronavirus, they are more likely to have problems from it. But to be clear, most people who catch this virus will have a mild disease.
A lot of people will find these social distancing measures very challenging. There's a question here on social media from Patricia. Now, she's in her 70s. She's facing tragic circumstances. She's going to her own daughter's funeral. She has a pre-existing heart condition. What's your advice? Should she go?
Well, very clearly, if someone's going to their own daughter's funeral, that's a huge event, and none of us would want to say people should not attend it. What we would want someone to do in that very unique circumstance is to just try and keep as much physical distance as possible from people if they've got pre-existing health conditions, and just to take sensible precautions.
How much longer do you think we're going to have to live under these measures for? We've had a question from Ichabod, who really wants to know, I guess, when we're going to get back to normal.
I think that what we've said from the beginning is that this is going to be a long haul. We described it as a marathon, not a sprint. And we do have to be able to do things over many weeks to months if we are going to actually seriously get on top of this epidemic that is heading our way.
And that's why the Prime Minister perhaps referred to the fact that he's not afraid to go further and faster. Can you give us any idea what those measures might look like? There is some talk of a lockdown potentially in London, potentially beyond there.
Well, what we've said from the beginning is that as the epidemic progresses, we will do more things at the right time. But each of the things we're doing and all the things that you've described so far are very disruptive to people's lives. And we're very keen to do them at the right time, but not before the right time. But there may well be, as this epidemic starts to take off, there may well be significant other things that the Prime Minister may wish to do.
Thank you very much, Professor Chris Whitty. And with that degree of uncertainty, it's not surprising that lots of you have been asking about your business, your employment rights, or what you need to do, for example, if you need to see your GP or if you have a hospital appointment. We're going to speak to John Kay in Bristol in a moment. First of all, our correspondent Sarah Campbell is getting some answers, hopefully at a GP surgery in Bradford. Sarah.
Well, indeed. Well, with all that's going on, it's sometimes hard to remember that people are still falling ill as usual. Children are falling over in playgrounds. People need vaccinations. They need tests. They need prescriptions. And GP surgeries are right at the forefront of that. And they're having to fundamentally change the way they operate. To find out what's happening here in Bradford, I have Dr. Amir Khan. First question, most important question. If people have that new persistent cough and a high fever, what should they do?
The message is very clear and it's still the same. If you've got a high fever or a new cough, you stay at home, you don't come to the GP surgery, you don't go to hospitals, you go to the NHS 111 website and that will direct you as to what to do.
So that's relatively clear, but there's huge grey areas here, aren't there? So what about people who aren't quite sure, you're not quite sure? They are actually now having to be brought in via a different entrance, is that right?
That's right. So we've still got the normal coughs, colds and bugs around, and some of those people need to be seen and they haven't got symptoms like the coronavirus. We'll bring them in through a separate entrance. We'll be wearing a gown, a mask and gloves. They'll be asked to put a mask on as well, and we will assess them to see whether they need treatment here or via 111.
And really the main change here, isn't it? It's triage by phone. You're trying to stop people coming into surgeries, right?
That's right. Every single patient is triaged. Nobody can walk in and make an appointment. We need to ask them on the phone whether they've got a new cough, fever, temperature, and if the answer is no, we will then try and see them if we can.
What about things like infant vaccination clinics, smear tests, all these really important things? Are they still going on as normal?
Yes, they are really important, and we're prioritising immunisations in particular. We don't want children not immunised to get measles and then the coronavirus on top of that. That could be potentially devastating.
Okay. And you obviously have a lot of vulnerable patients, elderly patients. How are they going to get treated?
Yeah, that's really key. So we are still speaking to our elderly, vulnerable patients on the phone, and if they are housebound and need to be seen, we are still going out and doing home visits to them.
Okay, the big news today is about school closures. I know you already have 5 doctors self-isolating here. How might that affect you?
Well, if any more of our staff are off, really, we'd really struggle to function as a practice. So we're hoping we'll get more guidance on that.
Okay, well, I just want to say it's not just about doctors, is it? It's about sort of key staff. So we've got the receptionist here, Andrea. You've got 4 children aged between 5 and 18. So what does this school news mean for you? Are you going to be able to come in and work?
No, probably not, 'cause I've got one at college, 2 at primary school and 1 at secondary school. So I'm going to have to school them myself from home. And the kids have quite a lot of time off anyway, so it's something that we could do without, really.
And how sort of worried are you? Have you got sort of any other people that can look after them?
Well, I've got my mum who's elderly, so you can't really mix the elderly with the young, because like I said, my mum's vulnerable, so I'm going to have to stay off work and look after the kids myself.
Yeah, so lots of worries here on that front. I just want to finish with Dr. Khan again. If you had one message, the most important message for your patients, what would that be?
The key message is if you think you may have symptoms consistent with the coronavirus, stay at home, don't come here, don't go to the hospital. There's lots of vulnerable people there that you risk infecting. Go on the NHS 111 website.
Okay, Dr. Khan, thanks very much indeed. Lots of good advice there. Well, that's the view here at this GP surgery in Bradford. Now over to Bristol and my colleague John Kay.
Yeah, this is the Cauldron Restaurant. Normally it's a bustling, busy family restaurant. I drive past a lot, see tons of people sitting here, but look, empty tables. This is the reality of social distancing. Since those new regulations, those new advice came in on Monday, this place has not been able to function as a restaurant. So what does that mean for the lives and the livelihoods of Henry's staff? Hi Henry, thanks for having us here. You are having to diversify to survive, aren't you? Just explain how.
Absolutely. We have closed our door to customers coming in to sit in the restaurant, but we have a lot of produce left over and we're now going to sell that to our local community and provide a service of a greengrocer, and a dispensary of different products instead of using them in the restaurant. And we're also going to turn takeaway ready meals and Sunday roasts in foil trays.
So that will be for people to cook at home?
To reheat at home, absolutely. It's a product that we can use our local producers and suppliers. We have our salad grown nearby, we have coffee roasted in the area, we have beer brewed just across the road, and we can now sell that to our customers to take home like a dispensary shop.
I mean, you've now got in front of you, you are now selling face masks, toilet rolls, gloves, hand sanitizer. As a businessman, you could never have imagined you'd be in this position. I mean, when you lie in bed at night right now, what are you thinking about your future, the future of your staff?
These are sought after items. At the moment, I need to make sure I can pay my staff. I need to make sure I can pay the suppliers and the producers nearby that we use. And we have a responsibility to do what we can. We've had to change our business model to do whatever we can to survive. We're having something else here, a donation system where people can donate produce either from here or from home for people that aren't employed anymore or who don't have the money to come here and buy it. There are some great schemes in Bristol of buy one, give one, and there's ways for people to give to the people that can't.
The beginning of this week you had 10 members of staff. Already you have 3, right?
Absolutely, yeah. A few have self-isolated and the others we simply can't afford to employ.
Henry, thank you. We'll come back to you in a second because I know you've got a question for one of our experts, but this is Millie and Holly, and I want to talk to you as customers, but also about the education system, because Millie, you're a teacher and a mum, and now this news tonight, you're going to have the kids at home and you're not going to go to work. I mean, what's going through your head this evening?
It's a really crazy set of circumstances. As a teacher, I'm really committed to making sure that all the students who I still support and care about are supported with lots of online learning. The school are working really hard on that. As a mum, it's quite daunting. I'm going to do lots of learning with my daughter and supporting the older one too.
I suppose you're a teacher, you know what you're doing. Lots of us as parents have no idea how to teach our kids. I mean, this is new territory for every one of us, isn't it?
It is. I think schools and teachers will try and support parents and carers as much as possible, but it's going to be tough, yeah.
Holly, you were supposed to be doing your GCSEs this summer. You've heard tonight the exams are off. What's going through your head?
I mean, I don't know, to be honest. Like, you've got these two opposite ends of the spectrum. You've got one, you're related. These exams, everyone's so stressed about, they're gone. But at the same time, I've just worked 12 years for nothing, and it just feels like, maybe not a waste, but it just feels stupid. No one works as hard for their mocks as they would their GCSEs. Just don't know what to do.
Well, I hope you get it sorted, and I hope home works and work works. Henry, let's go back to you, because I know you've got a really important question about these loans and grants that the government's been talking about.
Absolutely. I mean, it's fantastic. They have now said they're going to do this. It's going to make a huge difference for us knowing we can keep some staff on. But my question is when they're coming. Are they coming 24 hours, in a week, in a month? And how do we get them?
OK, Henry, thank you so much for having us here at the Cauldron. I was going to say restaurant, but it's not a restaurant anymore, is it? It's a dispensary. And that's Henry's question. Back to you.
Thank you so much, John. In fact, we'll get to that now. Hashtag BBC Your Questions for any more of your comments, and we're hoping to get through plenty of those. So once again, Fergus Walsh, the BBC's medical correspondent, here with us, joined too by epidemic specialist Professor Sian Griffiths and our business correspondent Nina Warhurst as well. So Nina, let's go to Henry's question first of all, if we can. He wants to know how small businesses access these government grants that the Chancellor Rishi Sunak announced yesterday.
Yeah, we heard about them yesterday, didn't we? Grants of £10,000 or £25,000 for businesses like Henry's in hospitality. The Treasury tell me they will be available from the beginning of April via your local authority, so via your council, and then the cash will come through a little bit later. As for the loans of up to £5 million, they'll come from the government via high street banks that you'll recognise, RBS, HSBC, Santander. They'll be available for applications from the beginning of next week. Then there will be a short wait. I know that is incredibly frustrating for lots of businesses. Some of them say they needed that cash yesterday, but the Treasury tell me they are doing everything they can to make this as quick and simple as possible.
Because there will be administrative processes
Absolutely.
to follow, won't there? So many people fall into this next category. David on Twitter brings this up. He says, I'm a self-employed performer. I've had my work cancelled. I've got no income. How will I be able to pay my mortgage and bills?
It's a really scary time for people who are self-employed, isn't it? So they fall into two categories. Those who are poorly or have been told to self-isolate can get employment support allowance immediately. They don't have to wait. They don't even have to attend a job centre. If you are well, like David, and your work has simply dried up because of coronavirus, you'll have to apply for job seekers allowance and universal credit. There'll be a short wait on that, but then you'll get about £80 a week. It's actually worth looking, though, at whether you're entitled to apply for a business interruption loan too, the types of which we were talking about slightly earlier. As for your mortgage, David, have a chat to your lender because you are entitled to that 3-month break from your mortgage.
Loads of people as well, I should say, getting in touch with us about what happens when these schools close and if they're then required to take time off work, stay at home, look after the kids. What are their rights?
Well, we have been told to stay at home and work there if we can. If you can do that and look after your kids, first of all, you deserve a medal, but you're also entitled to full pay. All of us have the right to look after our dependents if our circumstances change. What we don't have the right to is full pay. Expect big conversations with your employer about taking leave early, potentially about reduced pay. You know, tonight the Prime Minister said he recognises the pressure that school closures will put on so many families, and he said we will look at measures to support individuals. He didn't go further, though, and tonight charities are calling on the government for extra cash to support businesses so they can support families.
Thank you so much, by the way, for all your hundreds of comments that are coming through to us from viewers here on BBC One, from listeners as well to BBC 5 Live. What about the numbers around all this? Sian, perhaps I can ask this one to you. Andy's asking, how are we able to give out the numbers of those infected when only those with severe symptoms and those in hospital are being tested?
Well, that's right. We're testing those in hospitals, but there's also a community surveillance in spotted GP practices. So we can estimate using models. But from the Prime Minister said today that we're increasing the numbers of tests. Public Health England have announced that they have big ambitions for 10,000 a day next week and up to 25,000, because the way that testing is being done currently is going to change. It's going to be not necessarily just in hospital, and that'll make it much more accessible to the healthcare workers and others who are very concerned about not taking infection into protected places.
Exactly, and that's absolutely critical, isn't it, for frontline health workers? You were co-chair of the SARS inquiry, so you've looked at epidemics like this in the past. When and how will we know if these social distancing measures that we're all being asked to abide by are actually working?
Well, you can see changes in people's behaviour, but that's not very accurate. I mean, I think each of us will know how that's affecting us. But we'll see it by the fall in the number of positive tests. We'll see it by the fall in the numbers of people who are going into hospital and by the numbers of people who unfortunately pass away.
And Fergus, on those numbers, where do we stand at the moment in the UK?
Well, a rise of nearly 700 cases today alone, 104 deaths, 2,626 cases, but you can probably multiply that by at least 10 to get a fuller picture of the situation. But it's a sharply rising curve.
And Fergus, what next? If we're sitting here this time next week, what will we be talking about?
Well, I think the key message is we are all, as a society, in this together. We have to wash our hands. We have to comply with the social distancing measures, because if we don't, and we don't see the numbers of cases start to reduce somewhat in 2 or 3 weeks' time, then what is advisory at the moment could become compulsory. But just one thought, 99 out of 100 of this of us who get infected will survive this. So, you know, it's not a death sentence for the elderly and those with underlying health conditions. We will get through this.
Yeah, and Sian, can you give us anything positive then to cling on to at this stage?
I think this too will pass. If you look at SARS, the SARS epidemic at this point felt like it was never going to end. It did pass, and society was able to get back to normal afterwards.
Even though the numbers here are much bigger?
Numbers here are much bigger, but epidemics have that rise. When we're on that rising curve at the moment, they then turn and then they do tail off. But we do need to all do take our own measures, continue to wash our hands. Don't forget that part of the message. Do the social distancing. Just accept that we're going to have to maybe not see our mum on Mother's Day. Sad as that is, we may just have to phone and say, really sorry, this year we're not going to see you.
Well, that's an important message to end on. Thank you so much to all of you. Thank you. And if you missed any of the programme, it will be on BBC iPlayer. There's also lots more advice and explanation if you go to bbc.co.uk/coronavirus. Fergus and Sian will be carrying out a live Q&A in the next few minutes on the BBC News Facebook page. Thank you very much for watching. Take care. Goodbye.